Hi, Dr. Pelto here. I had a question that someone asked. They said, for chronic Achilles tendinosis, can Traumeel injection be useful? So I have to confess, I had to look this up. I am not familiar with Traumeel injection. This, as you can see, Flüssig Wundungen is done in Germany. Sorry, I probably murdered that word right there. And this is something that's done in Germany, but a lot of the German technology is what we use because they're more natural. I'm going to talk about shockwave is something that I tend to use for chronic Achilles tendinosis versus this injection. But I looked it up. It is a homeopathic plant-based anti-inflammatory solution that's injected intramuscularly at different acupuncture points or directly into the joints based on your unique condition. So Achilles tendonitis, you would inject it in there. Usually I would probably do it with ultrasound guidance to make sure you put it in the right spot. It contains 13 active ingredients from botanical and mineral sources and has been used in other countries such as Germany for 50 years. So I guess you would do it with an ultrasound. You'd put it in the right area of the Achilles tendon. That certainly could be done for you. You do not do cortisone injections, so that's maybe the reason they would do this type of an injection, because cortisone can weaken it. If you give me just some time, I'll explain how I tend to treat Achilles tendonitis. This is my treatment evaluator. I will put a link to my book on Achilles tendonitis and another video on Achilles tendonitis if you want to deep dive into those. But I find, since I don't do those injections, I do either an amnio injection, which is an amniotic stem cell injection, or a shockwave therapy, which I actually find much more effective. And I do that to the area to reduce pain. Now, along with these other types of treatments, that's a little bit beyond the scope of this little video. There are other things that you can do. If you want to research more, you can. But I find shockwave most effective. And then on the ultrasound, if I do see an area of a defect or swelling inside of the Achilles, or like a little tear, that's where I would do the amnio injection. So not everyone gets the amnio, but if there is like thickening, or hardening of the Achilles, that's where I would do the shockwave. If it's universal throughout it, thickened, I would do it. But then if there's a certain area of like a little tear in there, or an effusion, we call it, little black thing you would see on the ultrasound, then I would do the amnio or consider doing that. Once again, hope this was helpful for you. If you have any other questions, please put them underneath here, and please subscribe to the page. If you found it beneficial, please let me know. Thanks.